Hi, my name is Travis Martin, and I'm the Patient Experience Ambassador at Wambi. Wambi is the only real-time, patient-driven, and peer-to-peer recognition platform where patients and patients' family members have the opportunity to share their recognition in real time with those who have impacted and inspired them the most. With that being said, I'd like to take some time today to share a little bit about my story, how I got to be in this wonderful position with this amazing company, and go over a little bit of the past that I've had in the past couple of years. And as you can see, in this first picture right here, this is supposed to be the best and most special day of my life. This is my wedding day, May 20th, 2017, the day that I was going to become a father, a husband, and ultimately marry my best friend. We're together 6 years prior, so needless to say, this is the day we've long been waiting for. Unfortunately, prior to that though, my body was changing. I was suffering from several different issues and I couldn't really pinpoint one, but I had vision issues. I was lethargic, complete lack of energy, which is completely not like me. I was a million miles per hour all the time. I was suffering from balance issues. I had severely low testosterone. And even on that one day, my wedding day, my mom, my biggest fan, told me that my face looked like it was sinking in. So there's obvious signs that something was going on, which led me to go to a series of doctor's appointments. This started early in January 2017, and I started my primary care physician, and I was directed out to several different specialists. These specialists included urologists, neurologists, primary care physicians, optometrists, ophthalmologists, and I did over 4 CAT scans, 4 lumbar punctures, and gave over 40 blood draws. With all that being said, there was still no diagnosis. I remember the doctors telling me that they saw something in my CAT scan, but couldn't really figure out what it was. The blood draws gave nothing. So life goes on. But with that being said, there was ideas, there was possibilities, and these are some of the diagnoses that they came up with. AIDS, which no one ever wants to hear AIDS. I heard AIDS about 7 times, edema, sarcoid, MS, Brazilian parasite syndrome, and pituitary issues. At this point in my life, at 33 years old, I was so naive to the whole effect of any of these being a possibility. I was an athlete, I was in decent shape, and my whole life I felt like I took pretty good care of myself. But with all that being said, life goes on. So we decided to get married. We eloped and did a small intimate wedding in Savannah with our close family, and it was an amazing day. It was beautiful, but that day would be one of the days that led to my downfall. But prior to all this, I was supposed to go on to a honeymoon with my wife in Jamaica, but we knew with all the complications I was having medically, it was probably best to cancel it. Thank goodness. Instead, we decided to go to Orlando. We lived in Jacksonville, so it was a short little staycation, but that's where my situation would drastically change. It was our first day there, and I remember I was with my wife of now 2 days, excited, young, happy, and decided to go to the pool with her. It was during this time when I walked into a walk-in pool, no steps, and I started to drastically lose my balance. Unfortunately, then that's when my wife knew that we had to go. So after a short little debate, because I don't want to ruin her time, she said we needed to pack up and get in the car. At this time in my life too, another symptom I had is they thought I was narcoleptic. Anytime I got in a vehicle, I would fall asleep. And that was the case for this ride. The last thing I would remember would be leaving Orlando that day. But 4 days after my wedding, this is what my wife had to look at. Fortunately, I was back in Jacksonville, and on the way home from Orlando, I fell asleep immediately. My wife then turned to call some of the doctors. She reached one of my neurologists, told him the symptoms I was having and how I was losing my balance in the pool, and he said to drive him directly to Jacksonville to Downtown Baptist Medical Center. This is where these pictures are taken. As you can see here, I was not in good shape. I was wearing an eye patch because I had periodic alternating nystagmus and double vision. I was strapped to a lot of monitors and cords. And at this point in my time, I was still functioning. I was still talking. I was carrying conversations. But none of it was making any sense. They thought I was a drug addict at first. They thought that all these other complications could be something else, but no answers. So during the stay in the hospital, I would be in this shape for about a week and a half, and doctors would come by, my family was there, and they would just look at my body with blank stares and not much hope. This was running a toll on my family, obviously. This is not the honeymoon that my wife had asked for, and nor the situation I wanted to put anybody in. But this is where I was at in my life. An abyss, if you will. There were no answers. There were no solutions yet, but I was there. And so as this situation did not progress, it goes on this way for about a week and a half. It's not until that point where they decided to do an emergency craniotomy on me. And after that, my body recovered well from that surgery, and I went to sleep. The next day I'd wake up, though, my temperature was 106, which is never good. And this gentleman right here was Chris. He's one of the first heroes in this story. Chris was the nurse that luckily got me that day, and when I woke up with a temperature of 106, he just began to shift. And for the next 12 hours, and possibly even 13, he did everything possible for me. He was fighting tooth and nail for a stranger, for someone he's never met, and doing what he considered his job. But Chris did more than that. He went to every floor possible to get every apparatus to bring my temperature down. He went to every station to get any type of cooling pad, anything that would help in the situation, give me ice, and was running back and forth. Now, granted, I don't remember any of these things, even though I was awake at certain times, but my family told me that this was the gentleman who was the first one that saved my life. And thank goodness, because if it wasn't for Chris there that day, I'm pretty sure I would not be here. But Chris finally did it. He got my temperature down. After about 13 hours of fighting, my temperature dropped. And as my temperature finally lowered, my body went through so much duress, I slipped into a coma. The craniotomy results were still pending, so we had no answers there. But thankfully, knowing my situation, there was a charge nurse there that night. And she made a late night call to an oncologist to help me, her dying friend. She was actually my nephew's best friend's mom. So she knew me, knew my situation, knew I was a healthy guy, and knew this wasn't right. So thankfully, she was there that night and made the call. With that being said, that doctor came in. He showed up that night to my wife now of a week and a half, my mom, my dad, assessed the situation, took a look at my condition, and knew that it wasn't good. It was a very severe situation. But when he came in, he took charge. He thought outside the box, and he decided to bring my parents into a room with my wife. And I can't imagine that because I'm looking at this picture right now. And this is my dad, my best friend, my hero. And I knew that look in his face. And I couldn't imagine being in those shoes, looking down, helpless, hopeless, willing to give anything to switch positions to save his baby, just to save his little boy. But he was powerless. And it's probably the toughest picture I have to look at because even though I had no control of the situation, I never want to put anyone in that position. You don't want people to hurt. You don't want them to feel that way. And unfortunately, I did that. So the situation was definitely severe and drastic, and the doctor knew that. So he brought my wife, my mom and dad into a room late that night and told them, he was honest with them, transparent, and said, I'm not sure what Travis has. I'm 90% sure it's some form of cancer, but we don't have any positive results from the craniotomy. And so obviously the next question was, well, what do you think we should do? And since my body was in a coma, there was limited options. But the doctor told my wife, my parents, that given his age, his health, I think it's best that we give him a double dose of chemotherapy. And my dad's like, well, that's kind of drastic. Why would we do that? He's like, well, if we do nothing, I'm pretty sure your son in his condition is going to die within the next 10 hours. So now my wife, a week and a half, my mom and dad had a decision I couldn't make for myself. But essentially, it was the only shot we had. So that night, they said, do it. They decided to give me the double dose chemotherapy. And I received an immediate dose. This is unheard of, especially for anyone being in a coma. But this was our shot in the dark. This is the last chance. This is the miracle. And these pictures right here, this is what my family would look at for the next 6 days. Even though my body responded well, I was still unresponsive in a coma for the next 6 days. And so they're just there and watch in hopes that I wake up, in hopes that it would work, in hopes that their son, their brother, their uncle will come back to them. And fortunately enough for that doctor that night, that decision, and everyone around me in the healthcare field that was helping me, because it took a village, I did wake up. And that's where my journey would really begin. I never knew the impact that these employees would have in my life until I did wake up. I was 33 years old, recently married, but I had to learn how to walk again. I had to learn how to write my name. I had to learn how to feed myself. So to say that we're called patients, it truly means that, because you need a lot of patience to deal with us. I reverted back to a child, an infant, if you will. But the amazing care, the amazing humanity, the amazing way that these people treated me was unreal. I was treated like a person and not my room number. And just the little things these team members would do had drastic impacts in my life. Whether it was Jamisha, who would come in, one of my CNAs, and sing to me, or Glinda, who would dance with me at 3 a.m. to Al Green with my chemo pole, or Ashley, who would come in and just talk about her kids and show me pictures. It gave me life. It fed me. It fueled me. It was those little moments that no one got to see that lifted my spirits in what was the darkest time of my life. I had every opportunity and chance to go the dark route. But it was these moments, these impactful little things that aren't taught in any medical field, in any school or any book. But it was a human connection that they gave me that made me feel like Travis again. I wasn't Travis, the stage 4 brain cancer victim. I wasn't any of that. But when I did wake up, that was what I heard. Remember the doctor telling me that, Travis, you have stage 4 brain cancer. I knew there was no stage 5. But it was in these moments that it gave me this fuel to fight, a fight I didn't even know I had possible. And so I was obviously just overwhelmed with joy and passion and life. And it was fueled by all these little moments that they gave me. And they always talk about resilience, especially in situations like this. And resilience, I just want to put the definition up there, is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And I feel like as a patient, you face that. But I feel like it's twofold, because as a healthcare worker, you face that too. There's so many stressors, there's so many tragedies and traumas, it's on a daily basis. And the way that we're able to bounce back together from this difficult experience is a huge part of the positivity that helped change my life. And I truly believe that it goes both ways. The resiliency of my nurses, my CNAs, my doctors was incredible. Against all odds, I survived. So this would continue for the next 8 months. I did over 8 rounds of 2 double doses of chemotherapy, 2 very aggressive versions of it. I learned how to walk again. I gained 40 pounds from a slight pudding addiction I had. I lost that weight. And there was a lot of little victories along the way. And I'll never forget going on the floor. Once I was out for my initial 2-month stay, I'd come back and they'd be like, Travis, look at you, you're walking. And it'd be a celebration. They'd applaud. This is my family. I had my immediate family, but this is my second family. I spent more time with them in 2017 than I did my whole family. They were there every day. They would celebrate when I lost weight. They would celebrate and come dance with me. We'd have dance parties with the toxic waste crew. It was incredible the way that they made me feel. As alone as I was at times, I never really was. And to that, I owe them everything. They gave me a reason to fight. And so obviously, after the 8 months of treatment, I got the greatest news that I was cancer-free. I went from having one of the most unbelievable diagnoses at my age, an incredible recovery, to being cancer-free within 8 months. So to say I was thankful is an understatement. I obviously wanted to give back. Besides giving them hugs, going there, shaking their hands, and doing everything I possibly could, there was no other way I can give my gratitude. I baked cookies with my mom and share with them on the holidays. But the opportunity came up to where I could join the Patient Family Advisory Board at the hospital that saved my life. I eagerly accepted, or I should say they accepted me. I had to do a little application process, go to a board, but it got approved. Shortly after that, after attending a few meetings, I attended one where Wambi came. And Wambi came and presented, and my mind was blown. This is 2 months after my treatment. I was like, oh my goodness, if I had this, I could have verbally shown and told these people in real time the impact they made in my life. Because you do as a patient, you forget names, you forget who they are. And once I saw the platform, I was just enamored. So fortunately, I was able to be persistent and get a position with them. And now I have the opportunity in my life to share the gratitude that I have eternally for them and just share to every healthcare member and employee, because all these little moments make a difference. And you have no clue that one conversation, those few extra minutes you spend with them, what that does to a patient in their life. You don't know where their head's at, the situation they're in, or the fact they just need that human connection to talk to. And so with this, I knew I had found a purpose. And right here, just a couple pictures of my heroes. The one on the top left you'll see is Kyle. We actually have No Man Mondays where we go out to lunch with a couple of nurses from my recovery. Their husbands know about it, so it's nothing crazy there, but we have a great time. The one underneath it is Ashley, and she was one of my CNAs who was actually going to nursing school, and now she's a nurse. And I remember she'd come in and study my room, and I'd try to help her when I could. And then the one on the top right, that's my doctor. That's my Dr. Cavalieri, the one who made the bravest decision, thinking out of the box, and did exactly what he had to do to save my life. And sometimes words just don't justify it, but these are some of my heroes, and there's many more. And in this picture right here, these are an amazing example of what the cancer looked like. And instead of having just these two images, I had 58 tumors in my brain. So this is just a smidgen of what you could see. But in the top one, the arachnophobia looking creature, the highlighted area, that was cancer. And then the bottom one, you can see my brain stem with the highlighted area. It's swollen, not supposed to look like that. And that was another part of the cancer. And also, you can see my eyes deteriorating. So if you look at the bottom right and the left, it's amazing. In 8 months, it went from me essentially dying, eyeballs being eaten away, to being clear. And then right here, it kind of took foot in our local community where they did a couple stories on it. And one of them is the Jackson man dances his way through stage 4 brain cancer. We did have a Congo line, and we did make the best situation. But again, it goes to the credit of those who were fighting for me when I couldn't. They were fighting for a stranger, someone they didn't know. And they fought tooth and nail to get me where I am today. So once again, I would just like to honestly thank you again for your time today. And I'd be more than happy to answer any additional questions that you might have. Please feel free to contact me anytime. And remember how appreciative, grateful, and thankful we are all for what you do. And again, thank you. You never know when you walk into a room the impact you're going to make, the life you're going to save, or who you're going to help. And it's for all those little moments, those moments that go unseen, behind the curtain, behind the door. We thank you.